Okay, very good. So, George, we are now 6 weeks from your lift. So, tell me about your thoughts. I'm going to show your before and after pictures here. How did things turn out for you with the lift?
Turned out great. I couldn't be happier with it.
Very good. I'm glad to hear that. And your friends, what kind of comments have you heard from family or friends?
Well, I can't get them out of the room. They keep coming back and asking me more questions, but they've definitely noticed a difference. Usually, have I lost weight? Have I shaved my beard off?
Right.
Things of that nature, because they don't really know what it is, which is what I want.
Right.
And they're all very impressed with it when I tell them where I've been and what you've done.
And you mentioned how the women ask differently than the men. How is it that the women ask about it?
Well, the women, they want to know all about it. They want to know different things, and they all talk about the different things they want done. Where the men have that one thing that they want done, like I was. I had the one issue that I want to take care of, and of course in the process you actually took care of more than one issue, because I noticed that things are better under the eyes also, which we just did the lower lift, and I'm very pleased with it.
I'm glad to hear that. And you said that when the women leave the room, then the men start asking even more questions?
They ask even more questions. They don't want their wives to hear that, but I just ask all the questions. My wife knew everything about me anyway, so but she can even answer some of those questions, because she was here through the whole process and helped out with everything quite a bit.
And how was your discomfort through the procedure? Did you take much of your pain medicine?
No, I think I took one pain pill of the extra things that you prescribed, and I've still got them, and I'm not even taking them to this day.
Okay.
There was the best thing I can say is there was no pain to speak of, but you know, you'll have a little discomfort. No one likes to have their head bound up, but it's part of the process, and you have to realize that. And
wearing the wrap, yeah.
Wearing the wrap, you got the ice pack that you can put in there, which actually feel great, and it's really not an issue after you learn what you're doing with it.
Good.
And it's very, very easy learning curve to take care of.
Okay, I'm going to show some of your pictures here, so let me just put your... So here we are looking at your before and after pictures. We did the medium image lift, and just really proud of your result. You look good from every angle from the profile. You had a fair bit of tissue there, and what a nice improvement. You look real natural, and you had mentioned people said that they thought you had gotten your hair cut, and you said you actually gained 5 pounds because you just came back from a cruise.
Right.
So, well, it doesn't look like you've gained 5 pounds. And now you're a gospel singer, right? So may I ask, do you mind singing a little something? What's something that you like to sing?
Well, let's see what I can sing. Every singer has what's called their signature song. And mine's What a Wonderful Day. And I hope I do it well here. We'll find out.
I'll sing it with you.
Okay. What a wonderful day.
There you go.
That's all you get from
Thank you very much. So you're out on the stage, you're in front of people. So what does this do for you, being out in the stage, knowing you've got your new look?
Oh, the confidence level is totally different, especially the side shot, because in our business there's a lot of side shots to the audience, and it was always on my mind, and has been for years. And so now it's just taken that complete. That's one big load off my mind. I don't worry about that. Now I worry more about, is my soup pressed, than I do about that.
Good for you. That's amazing. And so you've been thinking about doing this for a while, and what was stopping you from having it done?
Well, honestly, I thought the cost would be prohibitive. And after I came and started talking to you, we actually talked for a while before I ever took the plunge. And when I did it, I found that it wasn't near as much as I thought it was going to be.
Very good. We're glad we can make that work for you. And you had a chance to look at our book?
I did.
What did you think about the book?
Well, the book helped out a lot. It answered a lot of questions that I had that I didn't even have to ask anymore. And I think a lot of people need to read that book, because when they read it, they'll lose this fear they have of it. They think, I want to make sure I'm not awake when this is happening, and I definitely was not, because you started the procedure and gave me the medication, and all I remember is waking up and my wife feeding me soup. And so it was a very easy procedure.
And you were conversant during the treatment, but you just didn't recall, but you were definitely answer questions and things like that, and that happens sometimes.
Right.
And so we've got some patients that are on the fence, and they're not sure whether they should do it or not. What would you tell someone who's considering whether or not they should do the treatment?
The first thing I tell them, come see you, get the book, and they'll make the right decision.
Very good. Thank you very much for sharing, and congratulations.
Thank
and
you.
good luck on your next performance. You're going to be in Alabama and near Tennessee. Your next performance.
That's correct.
Congratulations. Very good.
Thank you.